Flu season is here, and it will likely get worse in the months ahead. The flu can lead to some very serious complications, which is why Munson Healthcare is working hard to help spread the message about keeping your family healthy and safe. I'm Dr. Christine Nefcy. We will address some common misconceptions of flu shots and how they can help you protect your child, your family, and your community in this month's Your Health Matters.
Graduate from the board here soon, so they won't.
So let's start with the basics. Who should get the flu shot?
That's actually a very simple answer because essentially everyone should get the flu shot. Anybody 6 months or older through adulthood should and could and should get the flu shot, with a few exceptions of people who have medical contraindications.
Some people will say, every time I get the flu shot, I get the flu, or confuse maybe a stomach virus with influenza. Can you talk a little bit about the difference between those two?
Influenza, what we're talking about today, is a respiratory virus. Comes around in the winter. Typically it's high fever, cough, body aches. You hear people getting influenza and not being in work for 5, 6, 7 days, being on the couch. That's really what the influenza is. The term flu is used for a host of illnesses. Stomach flu is what we call gastroenteritis, vomiting, diarrhea. Generally a milder illness, more unpleasant, but not usually as life-threatening as respiratory influenza.
So you mentioned that the influenza is a wintertime illness. When's the best time to get the flu vaccine?
But really right now is the time to get it. If you don't get it in October, November's good, December's good. Last year the influenza season extended well into April. And so really getting it any time between now and the winter time, but
so it's not too late.
It's absolutely not too late.
So let's talk a little bit about community immunity. The idea that we vaccinate others to protect those more vulnerable members of our population who can't get the vaccine for various reasons.
We know that if enough people are vaccinated, enough people are protected, a disease like influenza or measles really can't gain foothold. So it's less likely that anybody's going to come in contact with someone who's infectious, who already has the disease. That includes people who haven't been immunized. It includes people who can't be immunized, such as a 2-month-old baby who's too young to be protected against whooping cough or too young to be immunized against measles.
You can find more information on immunizations and many more vaccination resources on our Your Health Matters page at upnorthlive.com.